Well, hello, everybody. Welcome to the Oregon Department of Human Services Self-Sufficiency Partners Meeting. Before we get too far along, I just want to make sure everybody knows that we are offering ASL and Spanish interpretation. To use the Spanish interpretation, go ahead and click the interpretation icon below and select how you would like to participate in our meeting. We also are offering CART transcription services today. Self-Sufficiency Programs is committed to developing and deepening our partnerships to provide outstanding and culturally specific services and supports to people in Oregon. This means listening, learning, and working together across ODHS programs and state agencies with the 9 tribes of Oregon, community-based organizations, and members of Oregon's communities. This virtual meeting occurs monthly and is a forum for updates, discussion, feedback, and Q&A about self-sufficiency programs and other related subject matter. This meeting is recorded so that we can share the meeting along with the presentations and minutes to those partners who are unable to join us today. The follow-up email with all corresponding documents and links will be sent in 1 week. So if it's not already, it looks like it is recording. So if there's any concerns about the recording, please do reach out to me, but it is helpful for others to have the recording. So unless I hear differently, we will plan to continue recording. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role. This is helpful to us and for partners for connection purposes. So I'm gonna take a moment to introduce myself in chat as well. Today's agenda includes presentations on the Healthy Homes Program, Crossroads Communities, and a Director's Office update. Presenters, we do ask that you turn your cameras on while presenting where able, as our partners appreciate seeing the person who is speaking. Of course, we would also like to invite all those that are willing, able, and comfortable to share your cameras as well. We would love to be in community with you, and seeing you makes that so much easier in this virtual space. So with that said, I think we will jump right into our very first presentation of the Healthy Homes Program.
Thank you so much, Misha. I'll just get my screen shared here. Let's see.
And I can go ahead and start. Can everybody hear me okay? Wonderful. So my name is Jordana Lieb, and I'm going to be kicking off the presentation today. I'm a program coordinator with the Healthy Homes Grant Program. I use she, her pronouns, and I'm a white person. And currently I am in my basement, so it looks like I'm in a dark cave. So I apologize if that looks a little strange. But we are really happy to be here today, and we are so grateful to have this opportunity to present to such a wide array of partners from around the state. So thank you for giving us this time on the agenda. We can go to the next slide. And before I carry on, I will let my coworker introduce himself.
Thanks, Jordana. Hopefully everyone can see the screen okay and hear me okay. My name is Matthew Ulsh. I'm a policy analyst with the Healthy Homes Grant Program, which Jordana and I and our colleagues have been working on for some time now. It's really nice to be with you all in this space, and I'm delighted to see some familiar names and faces. So thanks so much.
Thanks, Matt. And I just put our website in the chat, so you can get a little more information there as we go along. So here's what we're going to cover today. We're going to give a little bit of background and information about the Healthy Homes Grant Program and talk about the connection between health and housing. And then we're going to transition into talking about what you all are probably most interested in, which is our upcoming grant opportunity that we hope to launch in the next few weeks. And then we should have some time for questions and answers. Let's go to the next slide. So we like to start these presentations with this slide that talks about the connection between health and housing. We spend so much of our times indoors, and there are many things in the indoor environment that can affect our health. We work at the Oregon Health Authority in the Environmental Public Health section. So our number one concern is improving health outcomes for Oregonians. I did want to give a shout out that this month is Radon Awareness Month, and radon is the second leading cause of lung cancer. So it is important to test your home for radon. That is one substance in the home environment that can impact health. There's lots of other issues that can crop up and impact health, even things like broken stairs, causing falls, or, odors and gases like this slide says that are toxic and impacting indoor air quality. So many issues can crop up in the home that can impact health. Let's go to the next slide. So Matthew and I work for the Healthy Homes Grant Program, and this was a program that was established in 2021 with funding from the legislature. We got an additional amount of funding in 2022 as well. So our main focus is to provide financial assistance to persons in low-income households to repair and rehabilitate their residences. So the key thing here that I skipped when I said that was that we provide funding to eligible entities that provide this assistance to people. So it's really important to note that we do not fund individuals directly. We fund the organizations that support individuals. The other thing I wanted to call out is that we get a lot of questions about where our money comes from, and all of our funding comes from the Oregon legislature, so it's general funds. This is different than the federal HUD Healthy Homes program. So we get a lot of questions. Are you part of the HUD program? No, we are not part of the HUD program, but many of the folks that are going to be applying for our funds may get those funds from HUD. Let's go to the next slide. So some call outs here. These are things that we get a lot of questions on. What is the definition of resident? So we have that here for you to see. We also want to make sure people know that this funding is for homeowners and renters. We know that many low-income Oregonians are renters, so we want to make sure to support them as well. This is the definition of low income that we use here. And the program is only for low income residents. So people with moderate or higher incomes do not qualify for funding from our program. I said that already about the funding going to organizations and not to individuals. And then this last one we get a lot of questions about as well. The funding cannot be used for new construction. So although there's a big push to build more and more housing in Oregon, this money is not for that. It's to repair existing residences. Thank you. Okay, let's go to the next slide. So eligible entities, who are we talking about here? So you can see there's a wide array of entities that can apply for our funding. And Matthew will be talking more about specifics for our requests for grant applications coming up. One thing to call out here is federally recognized Indian tribes in Oregon will be receiving a tribal set-aside. And that is something that we are currently negotiating with our OHA Tribal Affairs Department. Let's see if there's anything else I was going to say here. As you can see, it's very diverse, the types of entities that can apply. And we're really excited to see in this first round of funding what we get and what the breakdown is. Let's go to the next slide. So what is covered by our funding? And Matthew will talk about this more, but just in general, what is our program all about? So these are the three main categories that we focus on: maximizing energy efficiency, extending the usable life of residences, and improving the health and safety, including the things that I mentioned earlier. So radon abatement, lead abatement, mold and mildew abatement, safety improvements. And we have a big list of other actions that we'll share in a little while, because I know that we get a lot of questions, you know, is this covered? Is that covered? So we can talk a little bit more about that in a minute. Let's go to the next slide. So again, we just have some visuals to show you what we're talking about. On the left, somebody is doing some lead abatement. The next image is putting in a wheelchair ramp. The next image is cleaning up mold. And then that last image is a radon abatement system that was installed in somebody's home. Let's see, I think that's it for me. And next slide. So I'm going to transition over to Matthew to talk about some of the specifics of our first request for grant applications. Thank you.
Thank you so much, Jordana. Hello again. This is Matthew Walsh speaking about round one funding for the Healthy Homes Grant Program. So what Jordana just described was the origins of the Healthy Homes Grant Program and some of our general establishing principles. And now I'll be talking about the specifics of the round one funding that we anticipate releasing information on later this month. So here is our draft timeline. We are into January 2024, hard to believe. We're still engaging in targeted outreach presently. That's what we're doing here. We expect our RFGA to launch end of January, early February, sometime in that window. We will be holding information sessions and office hours throughout the period that the request for grant applications is open. So anyone who has questions about the content of the request for grant application or the application process can connect with us through those. The applications will be due 60 days after the RFGA is released, so that exact date will depend on the launch date. Throughout April and May, we will be, we being the Healthy Homes Grant Program staff and our additional reviewers will be reviewing applications and making award decisions with our goal of having funding available by July 1 of 2024. And I'll go to the next slide. So we've got here some key funding priorities. Now, just to highlight the difference, Jordana earlier talked about all of the eligible activities that can happen under the Healthy Homes Grant Program, which all hold true. We have some key funding priorities set up for this competitive round of funding based on input received from engagements with the public, including our Administrative Rule Advisory Committee sessions and the Interagency Task Force on Healthy Homes. So our key funding priorities for this competitive round of funding are organizations experienced in improving the health or safety of occupants of residences, maximizing energy efficiency, or extending the usable life of homes which serve eligible households in Oregon, as well as organizations serving historically unrepresented and underserved communities, including people of color, low income, and American Indian and Alaska Native communities. Now, just to just to put a period on the end of that sentence, what this really means, we heard from the community, so many folks in the community telling us there's a lot of really great work already happening out there. We just need some additional funding. And so through that public engagement that I mentioned, we heard from Oregonians that the best and the quickest way to get funding where it needs to be into homes is through these organizations who have experience doing this type of work. So that's where we're starting. I'll get to the next slide here. So some specific examples of allowable activities. As Jordana mentioned earlier, it's quite a comprehensive list. So we've got a couple of slides here. I won't read these all out, but I encourage people to read through the list and check out our website if you're interested in more information. Now, an applicant entity can choose to do one or all of these allowable activities, but the overall goal of a project, as Jordana mentioned, needs to be either to improve energy efficiency, improve the health and safety of occupants of the residence, or extend the usable life of the residence. And going through some additional activities here, we know a lot of these will pop up. Say if there's a solar project going on or an energy efficiency project going on, there may be really tailored funding that's not usable for, say, insulation and ceiling or roof repairs. And so we really see this funding as a source of potential gap filling where those programs that are up and running and need some assistance to better stretch their current dollars can turn for help. So that's the intent behind this program. So this is one area where people are very keen to see what we have to offer. So these are our proposed funding amounts. There will be additional detail in the request for grant application as it's released. But you can see here, we are looking at awarding approximately $10 million for a 3-year period of performance, a 3-year grant cycle. We've got it broken up here, these awards, in small and large tracks because we anticipate supporting organizations ranging from small in size to quite large. The total number of grants we anticipate awarding in this initial cycle is up to 30 competitively awarded grants, in addition to the federally recognized tribal set-asides that Jordana mentioned earlier. So altogether, we're looking at $8.5 million competitively awarded to 30 grantees, altogether 40 grantees awarded up to $10 million. Now I should add the caveat there that we don't know who is going to apply or where they'll be applying from and what types of work they'll propose, but this is our best guess on what we can support for this initial round of funding. And so we are here to spread the word and asking folks to help us do the same. Everyone, we recognize that there is a large number of eligible entities that folks may or may not have a direct connection to. We've also seen the network effect of people providing support of this nature throughout Oregon. So we're really helping to get the word out so that if there's a client who needs a particular type of support, we can get the information out there for where to connect them. I should say as well, it's not on the slide, but as soon as we do have funded programs, those will be posted on our website as well, so that anyone can go and see what type of work and what organizations have been funded under this effort. So we've got some time now for questions and answers. Folks are free to speak up or drop questions in the chat. I believe Jordana has shared our website address, which is a great resource for more information and to stay connected. So with that said, I'll go ahead and stop sharing so we can see everybody and open it up for questions. Hi,
Looks like
Spencer.
Spencer has a question.
Hi, Matthew. Hi, Jordana. Good to see you again. Do applicants have to have specific addresses and projects identified, or is it more of a conceptual idea with which they apply?
That's a really good question, Spencer. Organizations applying do not need to have specific addresses upon application, so they can apply, at the conceptual level, as you mentioned. It will be a reporting requirement on the back end of each year for grantees to report to OHA a specific set of information, which will be included in the request for grant applications, and which we're trying to keep to a bare minimum, but there are some items in statute that we're required to collect. So really great question. Specific addresses, we don't plan on asking for specific addresses at any point. Specific households for assistance will not be required upon application, but we will require some household level information at the back end. Thank you for that. One other note. Oh, sorry, Beth, I see a hand. Go ahead, please.
Thank you. I really hope I didn't miss that. You didn't already say this and I missed it, but I understand the money is going to organizations, and these are organizations that can, like accomplish repairs or remediation. But how do individuals request? Are the individuals going to request help from your program, or are they going to go directly to the organizations that get awarded grants from you guys?
Really good.
Oh, I was just going to say, I can take this one and maybe you can take the one in the chat, Matthew.
Great.
If that's okay after. So this is something that we've been, really considering and looking for ideas around, but, we haven't solved exactly. But what Matthew said was, we will have a list of all the organizations that are funded on our website, so we can point people to that, and they can connect with those organizations, or social service providers can make those connections in the counties where organizations are funded. But we are not able to support individuals. So if an individual were to contact the Oregon Health Authority, we could only point them to our funded list and think about ways that we can make connections amongst folks like you, community partners, social service providers. And we're really open to ideas from groups like this about how to make those connections. Does that help?
It does help. One thought I have is that making a really strong connection for people, between people and their CCOs, in terms of like when people request flexible services or health related services, whatever it gets, like this could be that. And there could be, it's just hard to know how individuals would know about it and get through to because it sounds like a really fantastic program.
Yeah, thank you. Matthew, I don't know if you had anything to add, but is it reimbursement or pay advance and spend down? Do you want to tackle that one?
Yeah, happy to touch on that. Thanks to Jackie for asking the hard questions, the hard to answer ones. I'll answer this a couple ways. Let's see, the first thing I'll say is we have heard from our community engagements that these types of repairs are very, very expensive, and some of the organizations may not have very big budgets. So we are doing everything we can to make our payment terms as flexible as possible. Now, I can't promise anything. We're currently working through the machinations of bureaucracy to see what types of approvals or exceptions we can get. But we are working to make this the payment process as pain-free as possible, ideally in advance, but hopefully at a minimum with fewer reimbursement chunks. Now, that being said, we are learning every day some additional details about particular subsets of grantees that may or may not have existing grant agreements with the state of Oregon. So there will be more detail in the request for grant applications around this, but short response is for competitive applicants, we're working out the details. For any awardees who have existing program element contract or grant agreements in place with OHA, the payment terms from that program element may apply. And we're still seeking clarity on that one, but that'll be an area that we're sharing more information on. A couple more, let's see, Clean Energy Fund, and is this funding part of the Portland Clean Energy Fund? No, the Portland Clean Energy Fund dwarfs the Healthy Homes Grant Program in size. They have so much money. They seem to be a really great program. We're tracking them, but certainly different pots of money. One key difference I would point out is Portland Clean Energy Fund is focused on work in Portland, where the Healthy Homes Grant Program is focused on supporting the entirety of the state of Oregon. So really great question there. Let's see, Jordana, do you want to snag the next one? I see in the chat how much or what percentage is allowed for staff and administration time?
Yeah, so currently it's 20%. And this is something that Matthew knows more about than I do. But yeah, so we will have specific information about what is allowable and what is not around this. But currently, it's 20%.
Yep, that's spot on. And just to give people a little insight into the background, I think I saw Joe on the meeting here, who he would remember this. Hey, Joe. So when this program launched with House Bill 2842, there was actually a lower limit. It was set to 15%, and not just for administrative costs, but for administrative expenses and program delivery costs, which our interagency task force on healthy homes said, well, 15% seems a little low, and program development seems a little squishy. So we worked through the official channels to get that wording changed, so we at the Health Authority could set the administrative reimbursement rate at something that made sense for our communities.
And I think, Matt, we're about to get cut off because I see Misha raising her hand, and I know they have a full agenda. So Misha, is that what you would like to do?
Yes, thank you. What I would say, I know this is this program is of interest to many people on this call. If you have further questions for this team, you can put them in chat. They might be able to address them in chat, but if not, what we'll do is we'll put together a Q&A document, and we'll send that out with the meeting follow-up next week, so that those questions can get answered. And I know there's a lot of information on their website, so maybe we can put the website back in the chat again, just to remind folks. And can they reach out to you directly if they have some questions? Maybe you can put your emails in the chat as well.
Sure. Yeah. We've got contact emails on the website.
Okay.
And that website is things are happening really quickly as we're picking up steam here. So keep eyes peeled. We'll be adding to the frequently asked questions list and adding information there as soon as we have it to share. So thanks everyone so much for your time today.
All right, thank you so much. And I have been to their website, not in the last week, so I'm sure it has changed, but there's lots of great information on there. So I definitely encourage you to check out that website. So up next, we have an opportunity to hear from Michael about Crossroads Communities. One of the things we like to make sure there's room for in this meeting is for different organizations, different partners to talk to us about the work they're doing and what's happening within the organization. So I'm going to hand it over to Michael right now for that.
Well, good afternoon, everybody. My name is Michael Couch. I am the Executive Director of Crossroads Communities. We are probably the biggest little nonprofit you may have never heard of. We are located in Lebanon, Oregon, a town which you may or may not have also heard of. And our focus is being able to address the needs of rural Oregonians Many of the programs and services that we've been piloting will be usable in larger metropolitan areas, but again, our focus is assisting the underserved or underserved folks of rural Oregon. So coming from a background of English and terminology, please excuse the word humor, but I like to say that we help others do good well. It's my longstanding belief that most organizations want to do the best they possibly can with what they have. A lot of what Crossroads Communities does is bring other organizations together, provide connections, logistical services, and administrative services so that we are able to assist our target population, and we're also able to assist our peer organizations with assisting our target population. So to that extent, Crossroads Communities serves a number of positions within the areas we serve. We serve as administrator. We provide a lot of assistance to smaller organizations that don't have logistical capacity. We serve as a facilitator. We do a lot of community events and encourage collaboration between community partners. We serve as a host. We hold a lot of events that we are able to run ourselves, and we involve other folks in the community. We serve as an advocate because we understand that not everybody has a loud voice. They cannot always speak for themselves. We serve as a partner. Crossroads Communities' focus has been and always will be to be able to help others work with us and for us to actively work with others, that we are only as strong as the relationships we build. Crossroads Communities recently has become a developer. We've been in the process of creating systemic change within Oregon to be able to make it easier for housing to be built, making housing cheaper and more relevant on the minds of Oregonians. So that way more people can be housed with being able to use less of their income to stay housed. We're a service provider. We have a number of services that we bring to bear based on our understanding of the communities we serve. I like to say that we understand that there are holes in the safety net and we work to patch those. We understand what the communities need by actively asking, and then we backfill what other community partners do not offer. And of course, we serve as a community partner. Any of the communities we are involved in, we like to know what is needed. We don't like to tell what we think is needed. So we collaborate with rural Oregon counties. One of our programs that we ran a couple of years ago, we were invited into multiple different counties, and we still are in touch with those. We are located in Lynn County. However, we are in the process of expanding into Benton County, Marion County, and Polk County. We provide administrative and collaborative work in Lincoln County, Coos, Curry, and Douglas County. Crossroads Communities provides a connection to services and assists property developers in creating resident-friendly, inclusive designs for on-site program delivery. Previously, in certain programs that are focused on developing affordable housing, the focus has been on housing people using a housing-first approach. But unfortunately, Oregon has traditionally been very housing-only approach, where the service providers get people housed and say, okay, next. And unfortunately, a lot of those folks who need housing, but need additional services and maybe a little bit of hand-holding or education, they don't get that. And that causes damage to the property, alienates property developers and property owners, and makes it harder for those people to get housed in the future. One of the things that Crossroads Communities focuses on is championing the construction of affordable housing for rural Oregonians. This was the first site that we completed in Lebanon. It's a 48-unit affordable housing complex called Applegate Landing, which we did in conjunction with our partner, a developer called Applegate Homes. Rather than just focus on the affordable housing nature and say, yay, we have 48 units, we're all done, we also focus on providing coordination of on-site services. After having a very lengthy discussion with a property developer, we said, hey, if you'd like to build an activity center, we'll operate it. We found that over the course of the little over 2 years we've been in operation now, about 2.5 actually, that we have been able to maintain housing for residents who might otherwise have lost it. A lot of people are not aware that in affordable housing complexes, between the 42 and 48% of the apartments become vacant year over year. That means that there's a turnover rate of approximately half of the people who are in those housing units. Unfortunately, in the case of affordable housing, about 75% of people who vacate their apartment go to a worse situation in which they are currently live. So that means they may have to move in with family members, move in with a place that is not fit for human habitation, move into their car, start camping, situations which are deemed less than desirable. And only in 25% of cases of those apartments being vacated are they actually moving into a better situation. As part of our program with Applegate Landing, over our first 2 years, Crossroads Communities is able to prove that by hosting and coordinating on-site services for people to help keep them stable and provide them keys to success, basic life skills training, classrooms, connections to education, our vacancy rate over the course of the last 2 years is about 12%. Which means we're seeing about a 70% improvement on being able to maintain housing for folks, which makes it easier for program partners to get people housed and keep them housed, rather than have to constantly churn those numbers, having somebody housed in the very next month trying to get them housed again, or keeping people housed to make it easier for those numbers to be decreased. In addition, for the people that do leave Applegate Landing, 75% of them go to a better situation. So we've completely flipped the script there by providing many of the services that we do on site. So if you'd like to hear innovative, Crossroads Communities believes that we need to bring services to people and not expect people who have a lot of barriers to get to services. So the two rooms you see here, we have an on-site health office. This has changed slightly because one of our program partners now offers free dental clinics. So we have a dental chair in there as well. And the other is a mental health room, because we understand that people who are dealing with so much in their lives often need a little bit of additional support. A lot of folks who are low income or have recently been on the street have other concurrent conditions, substance use disorder issues, mental illnesses, that we like to be able to have a space where providers can come in and speak with them individually, but also with families, because anybody who's ever dealt with substance use disorder at home knows that it doesn't affect just the person who's dealing with that. It affects the whole family, from ACEs, or adverse childhood experience in the kids, to codependency in a spouse or partner. It's important to be able to address all the issues if we're looking to be able to create change. So we provide spaces for program partners to come to, because again, if you have a family of 5 with only 1 vehicle, when you say, oh yeah, it's just 1 town over, it'll be really easy, that suddenly becomes an all-day event, which someone may or may not keep up. If you say, yeah, just come down to our activity center, that's usually much more convenient and much easier for them to be able to keep the appointment. So one other thing that's important for Crossroads Communities is that in our name, it says it, communities. We believe very strongly in the power of socialization, and it is important whenever you have anybody who has traditionally been ignored by a community or feel like an outsider, it's imperative that those folks be able to be embraced and brought into the community. So we have a lot of amazing community events where we bring in folks with the affordable housing complexes we serve, so they can get to know their neighbors. But at the same point in time, we also involve the community at large, because if people are going to become part of a community, the community needs to become part of their life. So in addition to all those regimented services we also offer other stabilization services, such as food nutrition support. Crossroads Communities runs a food distribution program to help people who have a little bit of extra month at the end of their money, whether it be folks who are part of TANF or SNAP benefits, or folks that have not yet been connected to it, but still have some additional nutritional needs. We have food box available for residents, as well as the community as a whole. We also partner with the local Lebanon Soup Kitchen, so 2 nights a week we provide warm meals to residents at our facility. We've had individuals in the past, for example, we had a lady who has her 2 sons living with her, and one of her sons was involved in a catastrophic car accident. He was a medically induced coma. When you deal with the type of hardship that can put on a family, being able to provide 2 nights of warm meals where she can just focus on her family is invaluable. Very happy to announce that as of 2 months ago, Crossroads Communities finally is able to assist with transportation within the community. So we have a fully federally ADA compliant, ADA accessible van, which we're able to operate. We have this program available limited right now because we haven't received any major funding for it. We are operating the services within Lebanon and surrounding communities. We've worked so far to provide lots of services. We have a weekly resource day where we're able to do runs to local grocery stores, because if people don't have access to a vehicle, it can be very difficult trying to be able to get groceries situated in a public transit, which Lebanon is a small town, doesn't have much in the way of public transit. But it's also been invaluable for assisting clients for being able to make medical appointments. We had a client located in Lebanon who had to go up to Staten. She had no transportation, and it's very difficult to accommodate that. We were able to get her set up. So we generally, again, it's a matter of filling in holes in the safety net. So finding out services that are limited in scope, we see what we can do to be able to help expand those, hence with our transportation services. So also very important for us is creating collaborative discussions, talking with program partners, finding out what's needed, either helping them achieve it or finding out how we can help backfill. So it's imperative that whenever we're providing services to a community or to a specific segment of population, we do far more listening than we do talking, because we need to understand what it is they need before we can help create solutions. So whenever we create a program, it includes the voices of those whom it affects. One thing I can say I'm very proud of with Crossroads Communities is that my staff and myself and most of my board have lived experience. I was houseless for a year and a half after college. Had I not had the great support group I had from friends, I would have been homeless. But fortunately, I was able to couch surf for a year and a half until I got back on my feet. I have staff members who had previously been involved with judicial restraint. I've had staff members who are in recovery from substance use disorder. We have had staff members who were part of the Oregon foster child program, and they had expanded that. So we want to be able to have in our organization people who have that lived experience, because as I tell my staff and my board, empathy is so much better than sympathy. If you've been through it, if you know what to expect, you can guide people so much better. Just a quick note on our current project. As I mentioned, we provide housing advocacy, stability, and support in Lebanon at Applegate Landing. We have also started within Lebanon, the Lebanon Area Service Advocacy and Resource Partnership, where we're providing administration services and support for smaller nonprofits that don't have the capacity to do it themselves. We operate a 20-unit a permanent affordable housing complex in Lebanon that we just got this year through generous funds from Oregon Health Authority. Thank you, guys. We partner with the community health centers of Benton Lynn County to fund a dental care program where individuals who have low income, we can cover up to 100% of the cost for their dental care. We just got finished helping a gentleman who had not seen a dentist in 20 years. And his end up result, I think he has to pay $70 out of pocket for over $5,000 worth of dental coverage. We were funded at the federal level to open a Lebanon Community Services Center called the LCSC. It's only about 30% of what we need. We're in the process of building more. That will allow us to assist administratively to bring 14 service providers in Lynn County together to provide services at a single facility. If you understand what it's like trying to be able to provide services in a rural area where you have to tell people, well, you go to this town to get this service at these 3 places, and you can stay here in town to go to these 2 places. Isn't it so much easier if we can have them go to one location and have everybody provide services there? And that's our vision for the LCSC.
Michael, I'm going to interrupt you here just because we're over time and I've got somebody else who's waiting so patiently. But if you can send me this presentation, I'm sure there are interested folks and they can kind of check out some of that other information.
We were right at the end anyway, so that works out just fine.
Okay.
Conclude here.
All right, thank you. I'm so sorry. I hate to interrupt people, but I know that Michael is he's very open to chatting about what's going on. And so if you have interest in learning more, I definitely would encourage you to reach out to Michael and learn more about what's happening with Crossroads communities, in Lebanon community, but also in other communities with them. So, all right. So we are on to our director's office update. And I see Claire, she's right in the center of my screen. Thank you for being patient with us, Claire. I'm going to hand it over to you.
These meetings are great. I always learn so much. And you're right, I had never heard of you, Michael. So this is awesome. Really, really helpful. I come from sort of the affordable housing universe fundamentally. So that's nice to know you're around. So really quick, I can keep this pretty short. I just brought a couple of updates to share with you all that I think might be of interest. First, let me ask you, Misha, did you all already talk about the ODHS community partner meeting coming up?
We have not talked about that. It was in the email that went out to remind folks, but if you'd like to talk about that, that'd be great.
Great. I was just going to do a little bit of a reminder, let folks know that it's coming up on the 18th from 1 to 3. You need to register, and it's going to be both in person and virtual. So it'll be at our Northeast Portland office if you want to go there, or you can do it virtually, but it's going to be a really interesting program. And I encourage you all to participate if you want to find out sort of what's the haps at ODHS. The other thing that I wanted to share with you is something that is near and dear to many of our hearts, and that is this effort to put together a summer EBT program. For those of you who are following sort of the food work in the state of Oregon, you know that this is a brand new program being rolled out from the federal government for summer meals. And it has been a giant ask to get states ready to take it on in a very short time frame. That's part of the reason why it's such a giant ask. And what I wanted to share today is that we did get in our notice of intent to apply. So a lot of you might have seen that. They post all that information. It's been in the media a little bit. And I know the advocates are hard at work trying to get some support rallied for the funding that we need and all the approvals that we need to make that happen. But just wanted to let you know that we are working really hard. We have many teams of people working practically daily on this effort to try to get it all together so that we can launch in summer of 2024. It's a partnership between us and the Department of Education. It also includes Oregon Health Authority. It includes the One System, as you can imagine, and some of the pieces and parts over there. So there are a lot of interested people in getting this program out the door. And so I just wanted to share that perspective with you and let you know that we still have a long way to go. We still need to get through, some of the hurdles and some of the figuring that we need to do to determine exactly how it's going to go. But we're committed to keeping everybody posted. And I think there's probably going to be some sort of a more detailed briefing once we have a few more answers closer to the end of the month. But I didn't want you all to think we weren't just on top of this and all about it, really, in so many parts of the agency. It's a strong emphasis for us. And then the final thing I wanted to share is that next month, you're going to be hearing a whole lot more about the self-sufficiency program's vision into action work and how we are looking at the new world of the self-sufficiency program since eligibility has separated off into OEP and since ERDC, our employment-related daycare program, has gone over to DELC. It gives SSP, that opportunity, right, to think about what we're doing with our 500 family coaches, among other things. And so I know that a lot of you have contributed ideas and time and been a part of conversations. And so we're really getting close to being able to distill that all down for you into some action steps and things like that and get some more feedback. But I wanted to just remind you that as we roll into 2024, SSP is really focusing on 4 goals with this bridge strategy that we've developed. We want our services to lift people out of poverty and to keep them from experiencing it in the first place. We want our policies and our practices to reduce the racial wealth gap, and we want to support each person served to achieve their financial stability. The third goal is that we want our holistic services to be tailored to people and what they need and what they say they want, and to be the driver of the services that we provide. And we want to focus on future-facing skills and training and education to help folks achieve what they want to achieve. And then finally, we want to look at our case management, and we want to look at our resource navigation. And that's where a lot of you come in terms of being resources for the folks that we're working with. We want to do a better job of supporting referrals and connections that are accessible and equitable, so that everybody we work with can achieve what they want to achieve and address the barriers that are unique to them through partnership. So really appreciate all the work that you all are doing. Thanks for having me here for just a couple of minutes to rename those goals for you, and know that Patty is going to come back next month and share a whole lot more. But 2024 is going to be a hard one. We know that there are lots of things that are going to be hard to work through. And I want you all to know that we're committed to working with you, listening to you, hearing from you, whatever we need to know to do better, right? And to serve families and individuals better in Oregon. And I sincerely mean that. It's really the focus of the plan. So collaboration and partnership is it for 2024 for us. So don't hesitate to reach out. We're really accessible at SSP. I'm sure you can see that by the way Misha runs these meetings. So just wanted to reinforce that, say Happy New Year, and we're ready for 2024. I hope you are. It's going to take us all, I think. At least it feels like it. So thanks, Misha. That's it. Just a quickie.
All right, thank you, Claire. That is like perfect ending. That brought us right exactly to the end of our meeting. I know that folks do have some questions about SCBT. I know that we don't necessarily have answers to a lot of those questions yet. And like Claire mentioned, we're planning a briefing towards the end of the month. And so that would be a really great place to ask some of those questions. So I'll be sure to get that information out to you as soon as I have that information. But thank you all for being here today, and we look forward to seeing you again next month. And I'll get that meeting follow-up information to you next week so that you can take a look back at some of the stuff you learned about today. Thank you.